My guest today is Dr. Devika Bhushan, who is a pediatrician and public health leader and serves as senior advisor to entities advancing equity and resilience, ranging from nonprofits to a venture capital fund. As an adjunct faculty member at Stanford and on the boards for the National Alliance on Mental Illness and the California Partners Project. She lives openly with bipolar disorder, first disclosed publicly while serving as acting Surgeon General for California. She leads a newsletter community, Ask Dr. Devika, ab.substack.com, and YouTube channel podcast, youtube.com at Dr. Devika B, to share evidence-based insights for well-being. Dr. Devika Bhushan, welcome to Compassion in Action.
Hi, Fritzy. I'm just coming on video. How are you?
I'm great. Great to see you. Oh my God, it's so great to see you.
I know, same here. It's been so long.
I know I've been looking at your work and I'm so impressed with all the channels that you've opened from ACEs to your own healing and your own process. It's been a treat really to see what you've been doing.
Oh, thank you. That's so kind. And I love, supporting and championing you from long distance, and everything that you're doing I've always been a huge fan of just the way in which you work and also the outputs of that work.
Oh my God, I didn't, it's so weird when you hear people you admire talk about the work you're doing. It's kind of great. It impresses my soul, my soul's is smiling.
Oh,
So
I'm glad.
So do you want to jump into I have
Yes.
some like great questions that I'm really excited to hear. I'm going to start with ACEs and childhood trauma because I think this is where our audience really needs to continue to be reminded about the importance of this awareness. And so you were the acting Surgeon General of California, and you were one of the people that launched ACEs Aware. So can you tell us what that is and why you were driven to do this work?
Absolutely. So my background is as a pediatrician and a health equity researcher. And I joined the Office of the California Surgeon General in 2019 as that office was first getting off the ground and really defining its scope and its mission. So initially my charge was the chief health officer of that office. And I served in that role between 2019 and 2022. And my charge as chief health officer was really thinking about the research and clinical underpinnings of the ACEs Aware initiative. And that initiative launched the same year, 2019, which is really, really rapid in the landscape of government work. If anybody has ever worked in government, liaised with government, needed government for anything. So it launched literally the same exact year that our office was founded. And the ACEs Aware initiative, just to break it down for listeners, is a first in the nation initiative that really aims to equip healthcare providers and other providers with the knowledge they need to intervene at the root cause level for all kinds of health disparities that are really rooted in childhood trauma being unaddressed or not adequately addressed. And so we know, for example, so ACEs, listeners of this program will probably know the term very well, but adverse childhood experiences like child abuse or child neglect, or growing up in a household where somebody may have been in prison or jail or had an untreated mental illness, growing up in a situation like that is, one, extremely common. 2/3 of the population will have experienced at least one of these kinds of stressful circumstances. 2, very under-recognized and under-addressed in the healthcare realm, even though we know that ACEs at the population level, not saying anything about individual risk, but at the population level, we know that looking at all comers, the more ACEs that you've had in your life, the more you're going to be at risk for all kinds of health conditions, ranging from acute infections to heart disease and cancer. And when we treat people devoid of the context and devoid of the biological changes that might be underlying their presentation of, let's say, depression or diabetes, or that very early or advanced case of heart disease that looks very different, let's say in a 30-year-old than it should, and we fail to account for the neurological, endocrine, immune, and metabolic issues that might be dysregulated, and that need writing, right? That need a different kind of a care model. Then we are missing the mark. So, for example, if somebody's coming in with toxic stress, which is what we call all of those biological changes that can occur in the face of a very stressful set of life circumstances. If somebody's coming in with toxic stress and diabetes, and another patient is coming in with no toxic stress and diabetes, the way in which you treat those two patients should look materially different. And we know that toxic stress is amenable to treatment. It's a health condition, just like any other. And we sought in ACEs Aware to bring that into focus and help arm health personnel with the tools and techniques that they really needed to help patients re-regulate their stress response. Tools like mindfulness, anti-inflammatory nutrition, exercise, getting enough sleep, really connecting with the important people in our lives and having that source of buffering support, as well as, mental health supports when those are needed, if something is showing up as a set of mental health concerns or symptoms. So I'll pause there, but I'll say one other thing before I transition it back to you, which is that we launched this in 2019, and now we have 1.5 million patients directly screened through the Medi-Cal program and many others through other kinds of insurance programs. And officially about 35,000 individuals trained in the core training that we have online for healthcare providers. And I'm also really proud that we've started to build bridges to cross-sector supports, which we can talk more about as well.
So what is the importance of ACE Aware? So I know what you're saying. Your office is or the Surgeon General's office guided practitioners, pediatricians, practitioners to learn and know about ACEs and to have that as how they're diagnosing the children and people that are coming into their office, right? Is that what I'm?
Yeah. And let me say it very clearly. So the program, what it did was it offers a $29 reimbursement to screen your patients for ACEs. And these can be patients who are kids, so 0 to 18 for sure. But actually the program goes all the way up until the age of 64. So you can still be affected by toxic stress as a 50-year-old, as a 30-year-old, well into your adult life. And so the program was really set up to incentivize Medi-Cal providers to be able to screen for ACEs as a marker, as one of the markers for clinical risk of toxic stress, and then to treat that toxic stress physiology as a key component of treating a health condition.
So toxic stress now. So I want to talk about ACE awareness because I think that is the key. I think that's the key thing that's up for our society. But toxic stress, from what I know, is it's repeated doses, as Nadine Burke-Harris says, repeated doses of stressful situations like parents fighting or living in a dangerous neighborhood or going to school and knowing somebody is going to hurt them.
Right.
And so what puts our body into fight or flight, which is a great thing when there's a bear in the room. But if this is a constant state of stress, that's what toxic stress is. Does that sound about right?
So there's two parts to toxic stress. There's exactly what you said, where we have a stress response that is biologically helpful. It comes online to help us escape from predators, escape threats to our health, to our life and health. And it's really designed to be turned back down. So when let's say we take a math test where, in fifth grade, and we go in and we have our stress response is activated to really help us do the best work that we can on that test. And then it's dialed back down right after that experience is over. That is a very different experience. And those sorts of positive stressors are needed so that we can learn to turn on and off the stress response system and get better and better at dealing with these kinds of small stressors along the way. The problem comes when the threat response system is overactivated in a chaotic and unpredictable way, where those threats and those stressors are so large and so constant that our threat response system or our stress response system is not really able to ever be dialed back down. Then we get stuck in the state of survival mode, and we have an unhealthy and dysregulated stress response system, which then goes on to have consequences for the way that our brain develops, for the way that our hormonal cascades develop, for the way that our immune system acts, for the way that our metabolic systems act, and all of those other changes in our biology, which hinge on that stress response still being activated and never really turned back down in the way that we would want or expect. That is also part of what we call the toxic stress response, which is then amenable to treatment. And I will say, one of the things we learned early on in the ACEs Aware initiative is that these concepts and terms such as trauma, toxic stress, are still fairly new. And they are thought about differently from different axes or different points of connecting with this conversation. So a developmental psychologist may define toxic stress differently than I just did. And a researcher who is really focused on, let's say, the neuroendocrine part of the stress response may define it slightly differently. And so I think we're still in this place where the field is early enough that that understanding is still, we're still building consensus around some of these basic concepts and understandings of them. But suffice it to say, toxic stress is the process that we describe when your stress response system is overactivated and left on for too much of your young life, especially.
And what happens to the young life when the stress response is overacted? What are the biological and especially brain changes that happen? I mean, I know this answer, but I want our listeners to really understand the crucial importance this is, that we start spreading this awareness and ending trauma and trauma situations in our children's lives.
Yeah. So one of the things that happens is that the brain becomes hypervigilant to stress and stressors in the future, and the stress response system becomes overreactive and overactive. So what does that really mean? It means that when you look at kind of a model of the brain where the top parts of the brain are really the smartest and most evolved parts of our whole nervous system, where we are able, with the prefrontal cortex, to do things like plan and have rational thought and decide on a variety of different complicated decisions. All of those sorts of processes, when you are in a threat or a survival mode, are shut down. We can't really access the most evolved parts of our brain. And instead, we're stuck in the limbic system, where we are the amygdala, for example, the fear processing and threat detection parts of our brain may be so overactive that all we're really able to pay attention to is, let's say, a scent in a classroom reminds a young person of, subconsciously, okay, this is all operating on the level of just subliminal input, where you might have a scent that involves the triggering of a memory that is traumatic, right? So it may be that the teacher's cologne reminds this young person of a traumatic abuser of their past that they've actually not thought about consciously for a long time, but even that little sensory cue can put them back into that threat activation and stress sensitized place where they shut down the parts of their brains that will help them process information well, encode that information, be able to connect with others in the classroom and with their teacher, be able to really sort out, and diminish conflicting emotions or competing thoughts that might be arising for them. So essentially, they shut off their ability to connect and their ability to learn. And that can be really problematic in the school setting, of course, but it becomes even more problematic when, let's say, the teacher doesn't recognize what's going on and labels that child as disruptive or not interested in what's going on in the classroom. And then what happens is that whole set of circumstances is misunderstood and mishandled often, and that student may be sent to the principal for not paying attention or for acting out and disrupting the classroom, instead of really inducing a whole set of other trauma responsive types of responses, which are really asking the questions of what happened to you, how can we best support you in your learning, how can we help re-regulate that stress response so that you are in a place where you can listen and learn and encode information and connect with others, right? So it's a very different set of tools that needs to be harnessed to re-regulate a traumatized person, as opposed to some of the tools that we automatically go to.
Yes, punitive tools is kind of, I think, what we've done before, which I also think is part of our own trauma. Like if a teacher's traumatized too, these kids are activating their trauma response, and we see this. We see the same things in prison, and so you're like what you're describing is exactly the same dynamics that we have in prison, because there's a hypervigilance there that doesn't ever end at this point. I mean, there are some places in prisons where it is more calm, a little more calm. And the importance of safety can't be underestimated, because we can't get into our cortex until we feel safe, right?
Totally. And connection helps us build that sense of safety. And it's really important to understand that, even small instances of exclusion or of feeling criticized and othered, they activate the exact same biological stress response that seeing a predator in the woods would, right? So it's the fact that we are so acutely attuned to all of these social cues of when we don't fit in, when we don't belong, when we feel othered and threatened. The reason we are so attuned to all of that makes a lot of sense if you look evolutionarily. Our very survival depended on being able to be in alliance with others and depending on others for real, your actual survival moment to moment. You couldn't do any of it by yourself. You needed to be in a tribe. And just as we have been so acutely attuned to like seeing a ferocious predator in the woods just out of the corner of our eye and suddenly being on high alert so that we can escape that threat. And exactly that same threat response coming online when we feel marginalized or excluded or criticized or any kind of social threat. It's really remarkable to think about what that means about us as a species, and to understand that can be going on for you when you're in a work meeting and you feel like somebody's talking over you, or you're in a social situation with a close family member and you suddenly hear a comment that makes you feel invalidated or unsupported. And why does that suddenly make you feel on edge and like in this moment of rage? Where is that coming from all of a sudden? And I think it's important to recognize, what's going on biologically there too.
Yes, and the interesting thing is, because being thrown out of our society is a survival issue, being alone in the woods is could mean death for us. Being connected is one of the most important things. And when I do the circle, the ACE circle with the men or the women, I ask, one of the questions I ask them is, how old were you when you thought you were alone? When you thought you were by yourself? And I had that response when I was 8. I thought, I'm on my own. And I can't trust the community, the family that I'm in. And I'll hear anywhere from 2 years, 3 years old, 8 years old, 18, whatever it is. But there is, for most of those people in prison, they felt that they did not belong and they were on their own. So that's what's going on in addition to all the other things that they're dealing with.
It's heartbreaking and so understandable, right? Because when you feel like you are on an island, there's nobody there but you, and you're it for you. That not only is such a profoundly isolating experience and thought process, but it cuts you off from some of these buffering sources of ability to connect with somebody else, to really re-regulate that stress response system. And it keeps you in a place where it's activated, and it's this active self-fulfilling prophecy, right?
Yes. And that's one of the reasons we built a curriculum called Trauma Talks. So the key here is that they do sit in community with each other, talking about what's going on, what happened to them. That's the key. And we are finding great success just by creating this awareness. So your ACE Aware program, I'm doing it in prison. I'm not teaching pediatricians, but I am creating an awareness. I want this to become a viral thing that everybody in prison who works and lives there knows that there's trauma here, and we need to address this, and we need to stop blaming people for all of the responses that's happening on a daily basis because of they're cut off, they're isolated, all these things that are being repeated that happened to them as children are being repeated to them while they're behind bars.
Absolutely. And being behind bars is one of the most acutely and chronically traumatizing experiences we could have ever cooked up as a species. So it's no surprise that literally almost everybody who's in that circumstance feels that threat activation and needs that connection more so than at any other time before. And what you're doing is saving and changing lives. And I just want to know, at this point, how many people have benefited from the program?
Well, there are 2 programs. There's a 1-day program, and then there's a 16-week. We have worked with, I think, about 4,000 people just on a 1-day workshop. And our Trauma Talks curriculum is throughout the United States, New Zealand. It's going to Northern Ireland, Scotland, Mississippi, Utah. So we're still in the pilot phase, but we've changed lives for about 300 people have gone through the curriculum.
And counting.
Oh, well, I just,
Absolutely.
It doesn't stop. Every day I make another appointment for another visit. But next week we're going to Pelican Bay, and last week we were at San Diego. So we will have been, we haven't been to all the prisons in California, but so far it's about 18 and counting.
Amazing. Amazing.
Yeah, it's a drive. And when I see the results of just one day telling people that they're not bad, they're traumatized. This is how the brain works. This is what happens to you when your brain is in toxic stress and traumatized. The light bulb goes on. And so everybody needs to know. And everybody needs to know about ACEs and what trauma does to the brain, body, and spirit. That's what I want to make sure happens in the next 2 years or year. Let's make it a year.
I love it.
So ACEs Aware, it's primarily for the physicians, but what have you seen happen to the mothers and caregivers of the people that have access to this information, who learn about their own childhood trauma, who learn about the trauma that they're, inadvertently giving to their children. I have 8 ACEs, and I gave my son 3 because of my inability. I didn't know. I knew something was wrong, but I didn't know what it was. And so my behavior was just what I learned from my mother, except for the whoopings and all that stuff. But I mean, from 8 to 3, that's good, but I would like it to go from 8 to 0. And let's make sure all mothers are armed, all caregivers, all parents are armed with this information and this, and this forgiveness, to forgive them for what they've done, because we all don't know what until we're conscious, we don't know what we're doing.
Absolutely. And a lot of us don't even recognize the patterns that we have learned and that have been encoded in our biology until we become parents. And then we have to contend with all of those things in a very new way. And so just backing up, I will say that addressing toxic stress and addressing the impact of ACEs in a parent or caregiver directly prevents ACEs in the next generation. Because once you have a handle on the way in which the traumatic experiences of your past show up in your current health, in your current set of behavioral patterns, in your current relationship patterns, etc. And once you understand those changes and your ability to shift those in the ways that you would desire to be, let's say, healthier or better serving of your own goals, then you are a better equipped caregiver and you are better able to negotiate difficult moments where your stress response is acutely activated. Say you're having a toddler tantrum moment, which happens all the time, speaking as a parent of a toddler. And just knowing for yourself what kinds of things are likely to activate you further in that moment versus what kinds of things might you need to re-regulate your own stress response so that you can act from a place of intention, rationality, compassion towards your toddler and not make an acute situation even more explosive. How can you sort of reorient that whole moment for everybody involved? You get better and better at that with insight into your own triggers, insight into what your own boundaries and self-care strategies need to be for you to be that healthiest version of yourself, which is a lifelong process for all of us, ACEs or no ACEs, mental illness history or no mental illness history. None of us come to parenthood feeling like we have read the book, we know exactly what to do, we're going to be perfect at it. We all want to do our best, but being in touch with and being in tune with your own emotional reactions and triggers and stressors and ways of responding that act best is something that anybody could benefit from. And especially when you have ACEs and toxic stress in the mix, being in a place where you have tools at your disposal to unravel that toxic stress, re-regulate your stress response system helps you be better at everything, right? Better at parenting, better at work, better to yourself, better to your partner, all of it. So it's truly crucial. So what we say sort of in the public health way of talking about this is that secondary or tertiary prevention of toxic stress, which is, after the toxic stress has shown up and it has affected health, even then it's not too late to learn techniques to re-regulate your stress response, like anti-inflammatory nutrition or exercise and connection and other strategies. Even then, it's not too late. And then that secondary or tertiary prevention of toxic stress in an adult has the ability to affect primary prevention of toxic stress in the next generation, meaning that next generation may never see toxic stress because of the work and health interventions around the toxic stress of their parent.
Yes. And so here's the secret that I've found is that when someone in prison learns about this ripples out to their families. And there is the potential that we don't have to have, or we can heal this toxic stress environment that these children are living in today, now. And so, it's, to me, it's all hands on deck, and my deck is the prison system, and some communities that I'm starting to work with. But this awareness is it's the first step, because we don't even know. I didn't even know I was doing, I knew I was yelling at my son and it didn't feel right, but I didn't know I was damaging his brain. I didn't know I was changing his stress response to becoming more hypervigilant every time I walked into the room. I mean, how, I'm still recovering from realizing the damage that I've done to him. I still have some issues forgiving myself. And I'm working on it, because I know that's key. Because it's key to the way I interact with him now. But the thing is, we want to do no harm, right? Like the Hippocratic oath of a parent, which I think we should all start taking as well.
I know, but Fritzy, here's the truth of the matter. No parent wants to do harm to their child. And when it happens, however it happens, I think it's so important to recognize where the harm came from. And sometimes we may be transmitting harm that we're not even conscious of, as you were mentioning. And I think it's so important to give yourself that proverbial giant hug of, you were doing the best that you could with what you had in that moment.
I know. And I just want all mothers and fathers to know this, that we're not mad at them. We just want them to get help. And
we want them to heal. We want them to heal.
Yes. And so do you have any advice? Do you have any great brainstorm ideas? Any other ways we can start addressing this so that more people learn about this? I walked into San Quentin, the California model, trauma informed. And I said, how many people here know what an ACE is? No, 2 people raised their hands, but they had already been working with me. So I'm like, wait a second. I thought this was the California. I'm not putting anybody down,
Sure.
but
Sure.
Let's go. We need this information now, because a child is getting beaten up right now by his parent. Right now. I know that. And we need this info. And, a lot of people in prison say, I say, what's the story you told yourself when you were being assaulted by your parents? And they're saying, I deserved it. So there's a myth that goes through a lot of the people I think in my mother's ideas is about raising child, that the physical punishment is okay, that a verbal assault is okay. And when we let them know this is changing their brain, they're changing their whole trajectory of their lives, possibly. I think they would stop it. But what can we do? What can I do? How can I amplify your work, and Dr. Nadine Burke-Harris's work, and the vision of the governor's work?
Yeah. So when we envision a moment where we've acted in a way relative to a young person that we regret, let's say I've raised my voice with my son, and I suddenly see that he's not listening anymore, that his eyes have kind of filled and he's about to have a major meltdown, because all he is hearing is the tone of the voice, the anger behind that tone, and he is not understanding the words that are coming at him. He's not, again, that cortex has started to shut down, and he's now just living in that state of fear in his limbic brain. So even in that moment, for me to recognize that, oops, there has been a transgression and I regret this, being able to be in touch with your own feelings and understand that, hey, I'm in a place where I'm activated. Maybe I need to step away. Or what is it that I can quickly do in this moment to re-regulate my stress response? Maybe it's taking 3 deep breaths. Maybe it is noticing, my feet on the floor, really grounding into my body, and instead of being in my hot-headed brain, right? And being equipped with what it is for you that works in those moments to recenter and re-regulate and come back to baseline. And it's not going to be easy every single time. It's going to be hard some of the time or much of the time. But the more we practice that, coming back to ourselves when we're in this moment of activation and limbic discharge, it gets easier and easier and easier, just like any other skill. And so once we're able to re-regulate, then maybe I come back to my son and I say, hey, I'm so sorry. I lost my temper. I was feeling a lot of stress in this moment. It wasn't about you. And I give him a big hug and I help him re-regulate, right? And I speak to him really soothingly and calm. And then I give him the message that I needed for him to hear, that maybe he shouldn't be touching the hot furnace because I'm afraid he's going to get burned. So allowing for ourselves to have mess ups, because we all will, but then also knowing what to do next, because what we do next helps that child rewrite that narrative from I am bad and I don't deserve to be loved to my mom is having a hard moment. My mom is having a hard day. And sometimes parents lose their cool when stuff is really stressing them out. And that's an important and nuanced set of messages for us to be able to deliver to our kids. Because here's the thing, none of us are going to ever walk through any relationship of our lives nor react perfectly under all circumstances all the time. And the truth is, when those ruptures happen, we just need to be able to know how to rebuild in a way that affirms the other party, affirms ourselves, forgives ourselves, and allows for there to be a next page to that relationship that feels better, that feels different, and a kid is never going to be around a caregiver who never messes up in any way. So it's just important for us to do those three things, right? Like be in touch with our own emotions, find those grounding activities and exercises that we need. Sometimes it's an exit where we say, hey, grandma, hey, husband, hey, older sister, I need you to take over for 5 minutes. I need to go get a breather. And then repairing in a way that helps our children understand that they are not bad, that something that happened their behavior may have been something that we need to modify or think differently about, but that they are not bad people, that there is always love behind any sort of interaction with them.
Yeah. So shame is prevalent in prison. There's a belief, an underlying belief that they are fundamentally bad. And that happened from the first insult that they received and or the first hit that they received or whatever. And even seeing their parents fight, that information was interpreted as something's wrong with me. And that's just in prison, but I had the same responses as well. That's what I see in prison, but I had the same responses about myself as well. And so that's another, I think what you just described was transmuting the shame into seeing your mother as being out of balance instead of you being fundamentally bad. And that's such an important message to deliver to your child, because I don't know why we go right to shame, why these things we go right to shame, but that's one of the lowest emotions we have that keeps us in this lower state instead of, the exalted, glorious state of being a human,
Yeah. Yeah. And Fritzi, for you, I'm curious, like how have you found your journey out of shame? Like, what's that been like for you?
For the most part, it happened the day I read The Body Keeps the Score.
Mm-hmm.
That awakening, most of the shame peeled off that day was, oh, my behavior is not who I am. And it drove me when I walked into a prison. That's the drive came. The drive woke up. It's like, we got to get everybody out of this. Because it's as Paul Conti says, trauma is a virus, and we're until we stop the spread, we're going to keep giving it to each other. And so that's our next campaign, is stop the spread. But there's still, I'd say the shame is gone. There's some regret though with my son. Just regret that I was so checked out. I missed some of those great moments when he was, 4, 5, 6, because I was so whacked out. So, yeah, I didn't think I'd have that, but in this conversation. But I also want to really talk before this, because we're off to the races with one question. The stigma of coming forward with mental health. This is everywhere in prison. This is everywhere. There are people that are not allowed to go seek help with mental health.
Mm-hmm.
And so I don't know what we can do about that. But I also want to see if you have some things to say about coming forward with your own suffering and your own mental illness, your anxiety, your depression, and for you, bipolar. So
yes, thank you for opening that conversation. I think, listeners may know these statistics as well as we do, but there are rising rates of mental illness around this country. But despite that, when you look at the most recent statistics, you see that more than half of people who need treatment are not in treatment. And that has a whole variety of explanations, some of which include lack of access for various reasons, and some of which actually include stigma, a feeling of what I'm dealing with is either not valid or real, and therefore I don't deserve help, or a sense of self-stigma where we've internalized beliefs about our own ability to be a person as a consequence of having this mental health condition. So let's say we have bipolar disorder, and there are a variety of very negative stereotypes out there in the ethos about people with bipolar disorder. So, the data shows that the degree of self-stigma that you have internalized, which basically makes you feel like you won't be able to do the things that you've set out to do in your life. You will not be effective at those things. It also makes you feel like you may never recover, right? So self-stigma actually directly drives thoughts and acts of suicide. So it is very materially a question of life and death. It is not just this soft concept of how we feel about these illnesses and all that. And so that's just the self-stigma route. And we've also seen data that says the degree of self-stigma that you hold predicts a higher rate of relapse of any mental health condition. So more hospitalizations, longer duration of episodes, and a less good chance of recovery and time where you are well between episodes. So it really does affect quality of life. And then, the other layers of that are stigma by association. So what family members feel, what providers who treat mental health conditions feel, and it shows up in the way in which we still have not achieved parity with respect to how we reimburse mental health providers relative to physical health providers.
Mm-hmm.
The third level is public stigma. So the public attitudes, behaviors, and discriminatory practices around mental illness, which include the ways in which people with mental health conditions overwhelmingly end up living on the street, overwhelmingly end up in jails and prisons, which you see every day. And then the fourth level, which builds on all of this, is institutional stigma, which really is the way in which healthcare is delivered, as well as the conditions around that healthcare, the ways in which governments and other entities fund research and healthcare and other aspects of care with people with mental health conditions. There's a global study done in the Lancet that showed globally health budgets are only allotting 2% to mental health spending, which is wild when you think about the fact that depression is the number one stealer of life potential, and it's the number one disability in the world. So
Wow.
there's lots of layers to this, and it's really important to think about. And I really wanted to do my part to help explode some of these cultural norms, narratives, stereotypes that really exist around serious mental illness. And when I was serving as acting Surgeon General for California, it was really important to me to use that platform in particular to shine a light on mental illness. And, the Lancet the study that I mentioned, the same paper also surveyed around 216 different reviews that looked at what does it take to actually shift norms around stigma. And the number one facet that they found to be common across all kinds of campaigns, whether it was one-on-one or, internet campaigns, was people with lived experience of mental health conditions coming forward, sharing their truths. Because if we think about stereotypes in general, stereotypes exist when we have a very two-dimensional view of a set of experiences or of a kind of person, right? And what explodes stereotypes is when you get to know people in all of their complexity and all of their three-dimensionality who defy those stereotypes in one way or another. And then you come to understand that, hey, it doesn't make any sense to anchor my vision of, let's say, someone who has schizophrenia or someone who has depression with the image that I have of people at their most unwell. And in fact, most people spend a ton of their lives completely well, and you can't really tell from the outside looking in who has a diagnosis of a mental health condition, who doesn't, when it's well treated and when people are in a mode of recovery, which is not to say that it's not a chronic health condition and it could always be a concern again, but to understand that people have these complicated, long tails of recovery as well as illness, to understand that having a mental health condition does not mean that you can't achieve your dreams, whether that's to be a parent, whether that is to be a partner to somebody, or your professional dreams, I'm not the only person with a mental illness who was in government at a high level role. And more people are speaking out about it. We have examples like John Fetterman, right? Patrick Kennedy. And there's such power in being able to speak that truth, especially when I think a lot of people who are viewed as highly successful, if they have overcome something like that, or live with a chronic health condition like that, often it's not part of their narrative. It's not in their bio. It's not something that they talk about. It's something that they hide away. And what that does is it makes people feel who are in the hardest parts of their journeys like they will never achieve the dreams that they have, or they can't see themselves in positions of power. And it's not just about exploding stigma, but it's also about letting people know that lived experience of different kinds is needed and is important in policymaking, in high-level decision-making, in helping to change some of the systems of power and some of the policies that are in place today that adversely impact some of us who have not been in these rooms traditionally. So I think there was a lot there, but I was hoping to reach people who were really struggling to know that they were not alone and that they should hold out hope for a better tomorrow. And I was hoping to explode some of the stigma. And I was really gratified that at the response, there was just an outpouring of love and support. Tons of other people who wanted to share their stories, the stories of loved ones, lots and lots of collaborative partnership opportunities, including one I'm really proud of, which is a documentary platform called Brainstorm. Brainstormthefilm.com is where you can learn more, which really helps to unravel myths, stereotypes around bipolar disorder and feature the most cutting edge and innovative advances that we have in the field around diagnostics and therapeutics to help people understand how to diagnose bipolar disorder much sooner, because right now there's an 11-year gap between somebody having symptoms and getting the right treatment, or getting the right diagnosis, excuse me, for bipolar 2 disorder, which is harder to diagnose than bipolar 1 because hypomania can be very subtle relative to mania. But anyway, so it's a really powerful project, and lots of beautiful and collaborative opportunities came from the self-disclosure. So I feel really lucky about that.
Well, and also what you did, you removed the myth that we come out perfect, that we come out, exactly, the way we think we need to be. What you've done is you've taken the shame that people have for not being well, because I think most of us are not well sometimes. Most of us have reactivity, have yell at our child. We don't show up for our appointment, whatever it is, but none of us are perfect. And by you saying this is happening to me, you're allowing other people that opportunity to say, wait, this is happening to me. And, this, and it's, again, I feel like it's fascia, like we have built up this sense that we can't come forward with who we really are, because then they'd know that we're human, right?
Mm-hmm.
They would know that we're human. And that's the gift that your work is doing. This work specifically, you coming forward with your humanity. You came forward with who you are, which is perfect in that way, right? Because we can't have a Devika without some of this.
That's exactly right. And, I said in the op-ed that I published in the LA Times that, the person I am today is here not despite having bipolar disorder, but actually because of it, that all of these experiences walking through some of these hardest moments of my life ended up molding the exact human being that's here today, right? That has much deeper empathy for that experience, that can be a much better physician and a much better leader and a much better partner and a parent, actually, because of that experience, because of all that it taught me about myself and about who I am in the world and what I need to stay well and all of it. So yeah, absolutely. Thank you for that.
Yeah. And that's it. I hurt my child, as it's similar to what I'm going through, is me coming forward with my abuse to my son. It's not what I wanted to do, but it's something I did. But this journey of healing is going to help change other people's lives, and other parents are going to not have to go through what I did. And other people are not going to have to go through bipolar shame because of what you're doing. And so for people watching this, we're here with all of it, with all the pimples and, warts that we have. And this is what it is to be human. Otherwise, we have gods, we have David's standing in the middle of Florence. Great. And now he's looking down on us because we all have pimples. We all have adversity, and we all have pain, and we all have triumphs. So I think, and my dog just woke up.
I see him in the background. He's looking for something.
Wait, hold on. Let me just let him out. He'll keep barking.
Oh, sure.
Okay, let me let you out. Go ahead. Sorry.
No, that's what we're talking about, right? Imperfect moments, real moments.
I guess I'll keep that in. We all have them,
Yes,
so,
absolutely.
Yeah, so I just, I think, awareness about what you're doing, awareness about ACEs, awareness about our imperfections is the key to transforming our lives, but it's transformed my life. And it sounds like it's transformed your life. And I think it's the way forward for our society. I mean, even Oprah's talking about, Ozempic or whatever she's talking about, but also saying, I had a problem. And just coming forward that and normalizing that people have problems, normalizing addiction, normalizing. I mean, how many people are addicted? right?
Mhm.
To something. I'm a workaholic. I've been a workaholic, right?
Mhm.
That's an addiction.
Right. Yeah. And understanding some of the really deep-seated reasons for the ways in which we act towards ourselves. And, if we've developed a relationship with work that we're finding unhealthy, like where did that come from? How do we rewrite that? How do we get there? And it all requires such a healthy dose of self-compassion, of just like, no one is perfect. We all have problems, like you said, and we are all doing our very, very, very best at this thing called life. At any given moment, we're probably never going to get it perfect. And that's part of the deal. Like being okay with that and loving ourselves through that.
Exactly, exactly. And loving ourselves through the pain that we've caused others. And and if for people in prison, that can be extraordinary, extraordinary pain.
Yeah.
Um, and then on the other side of that, forgiving ourselves and vowing not to do it again and to move forward. And
Mm,
so, I feel that's the path. It's about forgiveness and redemption, I think, for all of us.
mhm.
Um, but
Yeah.
also, forgiveness for those who had a who had an opinion about your mental illness, forgiveness for that too. It's all wrapped up. It's all wrapped in the soup that we've created that I think we're starting to undo.
Yes. Yes, absolutely.
Is there anything else you want to tell our listeners in prison and in society? Any tips? I mean, I know you have this extraordinary blog about wellness, and by the way, what does non-inflammatory food look like? Because I know
So,
it is.
so what I would Google if people are looking for an anti-inflammatory diet is the Mediterranean diet, because that has shown just incredible benefits for health. And there's so many camps right now of like, what you should emphasize, what food groups and how it should look. But broad brushstrokes, and then I'll answer the question that you posed. Um, it's basically a lot of fruits and vegetables. It's healthy fats. It's less processed foods. So trying to minimize those kinds of things. And then it's taking out things like simple carbs and sugars, which really wreak havoc on our brains and bodies. And kind of saying, okay, what would our ancestors have been eating? And trying to do that, right? So it's not prescriptive. It's more kind of like these broad do's. Some don'ts, but mostly do's, and trying to eat within that. So anyway, but what would I say as a parting thought? Just that wherever you are on your journey, know that you are further along today than you were yesterday, and you will be further along tomorrow than you are today. And try to enjoy that journey, even when it feels horrible in the moment, even when it is really hard to see what next steps or tomorrow might even look like, whether you can even get there. Just try to trust in the fact that your overall trajectory is going in an intentional and a positive place, and believing that when you're depressed, for example, is the hardest thing in the world. And so and so just trusting in that fact, when it's hard for you to truly believe it, is important.
Yes, Eckhart Tolle says this too shall pass, and I think I have when I get into real brain ruts, I try and remember that, and I think I'm going to add to your last message is that
Please.
we
Yes.
we we get to give ourselves a break. I think
Yeah.
I
Yes.
think I think you know
Yeah.
we are gods, but flawed gods.
I like that. I like that.
So, Dr. Devika Bhushan, thank you so much for your time and your wisdom and your understanding about toxic stress, about ACEs, about bipolar disease disorder, and taking care of our mental health. It's a really important conversation. I really appreciate it.
Thank you so much for having me, for creating the space for this connection and for everything that you're doing, Fritzi, to make this world a better place. I really appreciate it.
Thank you so much. Thank you, Dr. Devika Bhushan. Thank you so much for giving us more information about adverse childhood experiences, about toxic stress, about the importance of awareness and how it's possible to heal from ACEs and to heal the next generation. What an incredibly encouraging and an urgent message that you've given us. And also coming forward about your bipolar disorder and how important it is to come forward about the truth of what's going on with us, that none of us are perfect. None of us are born perfect, and none of us have perfect lives. And so why should we be expected to have perfect lives? And the conversation you're having in public is helping change so many lives. And I'm glad to have had you on our show to reach more listeners, both inside and outside of prison. Thank you again, Dr. Bhushan. And if you enjoyed this podcast, please like, share, and go to our website at compassionprisonproject.org. And please, if you feel so inspired, donate to our cause so we can spread this work not only to people in prison, but to our communities, because adverse childhood experiences can change your life, and awareness about adverse childhood experiences can completely change the lives of your family members, of your community, and yourself. Thank you so much for watching.